Hello, welcome to CivilNet. My guests today are two professors from Columbia University in New York City, Kim Hekimian and Richard Deckelbaum. Welcome to CivilNet and thank you for joining us.
Thanks for having us.
Good to be here.
Kim, you were here taking part in an international symposium called Nutrition as a Key to Economic Development, the Case for Armenia. You have worked in Armenia for over 20 years. You worked at the American University of Armenia, and you were one of the pioneers in advancing the cause of breastfeeding for mothers in Armenia, which I think changed the narrative of how we look at health for newborn babies. But tell me about this symposium. There was 6 professors from Columbia, very impressive, very interesting, fascinating topics that you discussed in terms of nutrition and healthcare in the country. So can you just briefly tell us about the symposium?
Sure. Well, as you mentioned, we 20 years ago started work on promoting better infant feeding practices for optimal health for babies, and made quite a bit of progress in Armenia at that time. And recently, however, there's become a new understanding of issues of both undernutrition and overnutrition in the country. I'll let Dr. Deckelbaum talk about that more, but because of the growing interest in how to create policies and programs to address both under and overnutrition issues that are becoming more of an issue in Armenia, we were invited to have a symposium where we would discuss the latest globally, what's happening, and create discussions for presenting possible solutions to the issues in Armenia. So we were very lucky to have co-sponsors of World Vision, who is working on community nutrition education programs in Armenia, and FAR, the Fund for Armenian Relief, who is working in Tavush on a multi-sectoral program to reduce poverty and reduce undernutrition. So they were our primary co-sponsors. We were also very happy to be supported by Jinishan, the American Armenian Health Professionals Organization, the Armenian Medical Fund. They promoted and supported us to come and give 2 days lectures and presentations. We invited many people from the regions, so we had participants from almost every Mars. And we
Healthcare professionals?
Healthcare professionals, program planners, policymakers in the area of health and maternal child health.
Dr. Deckelbaum, I was looking over the synopsis of the 2-day conference, and there were some really very interesting topics that you all covered. One of them that was very interesting for me was the issue of stunting in Armenia, something that we don't often hear about. We do hear about, you know, those diseases, the #1 sort of killers of Armenians in the country. But before perhaps we talk about the minute details, just your overall impressions of healthcare situation in the country today.
Well, you know, when you're in Yerevan, you see really some very good health services. But then when you go to some of the poorer regions, the rural regions, and you see the poverty, and you see the amount of stunting. What does stunting mean? Stunting means that when you go into a grade 4 class, a good percentage of the kids look like they should be in grade 1. They're too short for their age. And this in itself carries big problems in that stunted kids become less productive adults, adults with increased risks of heart disease, and the women have smaller babies than they should. But the other thing that goes with stunting is there are root causes for stunting that still aren't understood in Armenia, but should and can be understood. So we have the methods now to understand this and to actually do the interventions. So I think in the 21st century, in terms of improving Armenia's overall productivity, overall job market, economic situation, we've really got to look at stunting. We know how to do it, we know how to approach it, but it's not happening.
In my experience in Armenia, stunting is what we often call an unseen disease or an invisible disease, because children are running around, they're eating potatoes and bread and things that fill up their stomach, and they're running around, but they're not receiving the right macro and micronutrients to let them reach their own cognitive potential. So then
stunting also affects your ability, your brain's ability to function.
Absolutely.
Properly.
The brains don't function as
well.
they should. And
Right.
there's definite evidence. Stunted kids aren't so smart.
So it's an issue of nutrition or proper nutrition. Is it also a problem of lack of knowledge or education on the part of parents who perhaps don't know how to feed their children properly?
So
or is it economic also?
It's a combination of factors, but interestingly enough, we know that in Armenia there are food products available that are affordable, that if given in the right combinations to children at the right time, starting from the age of 6 months when exclusive breastfeeding finishes, there's a period of time called complementary feeding, which is from age 6 months on, where you continue breastfeeding, but you add certain foods that will help promote optimal growth. And I think there's a window of opportunity for us to do better education of moms. I think that in promoting breastfeeding, we promoted mostly breastfeeding, but didn't really know to promote at the same time good complementary feeding. So we see a lack of iron-rich foods and a lack of protein-rich foods being given to young babies from 6 months on, and that's where we're seeing by age 2 or so, if you haven't given those kinds of nutrients at the right time, you do see a drop-off in growth, and then as a result, you see a drop-off in IQ.
Yeah, and one of the interesting things about stunting in Armenia, it's different than stunting in Bangladesh or Pakistan or India, in that a lot of it occurs after delivery. The babies aren't born stunted.
Predisposed to stunting.
Yeah. And we've seen some remarkable data here on this trip. For example, people have not been looking at intestinal worms. And in one of the studies that FAR, the Fund for Armenian Relief, is doing in Tavush, we found worms.
And it's a simple process to rectify, is it not?
Yeah, you treat the worms.
But is this something that is not being addressed by the health ministry or healthcare professionals?
It's not being addressed sufficiently. There are pockets where it might be being addressed, but it's not sufficient.
So there used to be, I think, under the Soviet Union at times, they used to do surveillance of parasites and deworming of communities where they found parasites, but that process broke down, and it's not expensive to do, but it requires some organization. There has to be a sense of importance, and I think that the FAR study shows that on some level there is still parasitic worms that will interfere with a child's growth and nutrition in ways that you would not necessarily know that your child is sick.
Because there would be no obvious symptoms of it, perhaps?
There may be, there may not be.
It depends how big the infestation is, but some kids could have big bellies. But besides causing stunting, it also could be a major contributor to anemia, to low hemoglobins. And yesterday, I think we saw an example in their books of a child with very low hemoglobin and faltering growth and a worm.
In part as a result of the collaboration between Columbia University and World Vision and FAR. Both World Vision and FAR's recent research that they presented at the conference, both of them took hemoglobin measures of the children that they're working with. First time that we've seen this kind of data presented, and both found high rates of anemia in children. And we would assume from this study that there's also high rates of anemia in moms. And so pregnant women who have high rates of anemia are already somewhat more at risk for having children that may have growth and nutrition problems.
And they themselves will have poorer outcomes in pregnancy.
So one of the areas of interest in the government is, and something that we support moving forward in terms of doing better assessments for promotion of, is food fortification, particularly flour fortification, which the government has put together. They had a working group, and they put together a series of regulation and legislation proposals sort of on the table now, and that would be to promote the fortification of flour with iron and with folic acid, which could help improve the growth and development of babies in utero. Perhaps Dr. Deckelbaum can talk about the role of folic acid in the development of the fetus.
Well, folic acid is the vitamin that has to be given before conception, before pregnancy starts to have its effects. And
so a woman should start to take folic acid when she decides that she's going to
try to get pregnant.
Or knows that she wants to have a family.
Right.
Because a lot of pregnancies happen, they're not planned when they happen. So we're promoting that all women of childbearing age should have folic acid, and a good way to do it is by flour fortification. And it's been proved in the countries that have fortified that it decreases cleft palate, decreases severe neural tube defects, other congenital anomalies. So it's almost a must.
So it's also important to educate the public, raise their level of awareness of the importance of folic acid intake.
Well, I think women want to have healthy families. And actually, in some groups, we've actually introduced it in high school, especially to girls. The concepts that if they want to have healthy kids and healthy families, the need to prepare for pregnancy before pregnancy. And one of those steps is really having folic acid. So if flours is not fortified, then women should be taking folic acid supplements if they're thinking of getting pregnant or they may get pregnant. In the United States, we say every day for someday.
Every day for someday. It's a good mantra to follow. This is also a policy issue, is it not? To fortify foods, I mean, this has to be legislated. This has to be part of the governance. I mean, the healthcare ministry has to put these practices into place or legislate them, yes?
Our understanding is that nutrition, and particularly maternal and child health nutrition, is a top priority of the government, and that they are developing national strategies to put forth both for fortification and for addressing the issue of stunting and undernutrition. Part of our interest here was to come to Armenia and explain to Armenia that systems that promote better issues of nutrition for children can be life cycle approaches to nutrition, that you shouldn't create programs and policies just to address children, that we have issues of nutrition throughout the life cycle, and the same system, the same policies, the same programs can promote healthy eating and healthy nutrition for the lifestyle.
Which is a key to economic development for the country.
Which is the key for economic development. I'd like to ask Dr. Deckelbaum to talk a little bit about the issue of obesity, heart disease, diabetes, non-communicable diseases that are just terrible for Armenia. The rates are terrible for Armenia, and we can do a lot to help prevent them and to help modify their consequences.
Well, just about obesity. I mean, I'm really quite shocked that you're talking about obesity being at high levels, because we don't see it as much here.
Well, we saw it. Here's the undernutrition. This is the overnutrition side of the double burden, and it's rampant here.
We see people in their middle ages. You see a lot of women and a lot of men who are certainly overweight, and overweight defined by their body mass index, and the impact of that weight on type 2 diabetes, on heart disease, on stroke, and on cancer is a very powerful combination. And all of us know people in Armenia who have had heart problems very early on. Most of us know people with diabetes and hypertension. It's epidemic. The third leading cause of death in Armenia today is diabetes. And
the first one is heart disease and stroke.
Yeah, and that's probably caused by poor lifestyle, smoking.
It's poor lifestyle, and the statistics we saw at the conference are frightening. Armenia is way ahead of its neighbors in Europe in terms of rates of heart disease, stroke, cancers, and a good part of this is preventable. Smoking, stop smoking.
Absolutely.
The high-fat diets, and you might want to mention what we found in these little
stores. What I found
stores.
Very interesting was that we walked into some village stores, some village kiosks, and immediately my team went right up and looked at what we call yuh,
right?
And the yuh is
in English
it's trans fatty acids.
It's vegetable ghee.
Vegetable ghee.
Yeah.
Which
I don't use. I just want to say for the record.
Well, it's hydrogenated oils. They're creating something called trans fatty acids, which the body does not dispose of.
And it's a major contributor to high cholesterol, to heart disease, perhaps even some cancers.
And this is an area where Armenia could get ahead of the curve with legislation and regulation, because most of the United States now has actually banned the use of trans fatty acids in cooking, and as a result, we have, at least on that one issue, made some progress in the U.S.
Dr. Deckelbaum, only because our time is limited, I want to ask you, both of you, a final question. You've worked not only in Canada and the United States, you've also worked in other countries as well. With all of the problems that we just discussed and all the statistics that we have that are quite frightening and are worrisome, is it possible to turn the tide on these kinds of diseases that we're seeing that are rampant in Armenia today?
I think other countries have done it in 10, 15 years, but with the knowledge that has been gained in other countries, I think within 5 years we could have high impact. And it requires the support of the government, the support of the health professionals, the support of the community, and it requires funding, because that's a key part. Investing in lifestyle and nutrition gives you returns much better than you'll ever get on Wall Street. But we need the initial investment.
Right. Okay, I'm Dr. Hekimian. As I said in my opening words, you have been working in Armenia for the last 2 decades, and as someone who has been passionate about certain healthcare, certain areas in healthcare, just very briefly, if you can, talk about the importance of preventive measures that we can all take, sort of being our own doctors, to try and figure out how to live healthier lives that will then impact, as we said, the development of the country. Because if you have an unhealthy population, you're not economically productive.
Armenia has had actually fantastic achievement in the area of public health. Where there has been a unified leadership on issues, they've seen great progress. About 20 years ago, during the terrible years of the transition, Armenia suffered from very high rates of infant mortality, and those rates were increasing. And as a government, as a diaspora, with the international aid agencies, they did a combination of interventions to treat infant diarrhea and acute respiratory illness better, and to promote breastfeeding, and to change the distribution of infant formula. And they saw a decrease in infant mortality over the course of a few years that's been very impressive. I think the same thing can happen again to address the issue of stunting if there's unified leadership, and there appears to be so. So I'm very optimistic. In terms of on an individual level, as you asked, honestly, the issue of smoking is a huge issue. The #1 killer of Armenians in Armenia today is smoking. And right behind it comes nutrition. So if we can eat healthier, one of the messages that came across in the conference, with one of the presentations actually you can see, is to create a plate of food called the Armenian plate. We have now in the United States put aside the pyramid. We don't use the pyramid. We have the My Plate. And half of the plate is colorful. Fruits and vegetables for half of the plate. A quarter of the plate, some kind of a lean protein, chicken or beef, not very fatty. And the last quarter of the plate is a whole grain, like bulgur or grechka or something that is...
That's part of our diets, yeah.
Perhaps mixed with some lentils or beans for sort of a perfect protein. And of course some dairy as well, milk, yogurt, or cheese. If you can follow that very simple plate, you can really change your own individual health.
And the Armenian plate should be the model not just for Armenia, but for the whole region. You can do it. Yeah. It's doable.
Yeah. Well, thanks to the efforts of professionals like yourself. So thank you very much for coming in today. I wish we had more time. There's so many facets of the conference and of the work that you're doing here in Armenia, but thank you very much for coming.
Thank you.
Thank you for having us.
I'd like to remind our viewers that my guests today were Drs. Kim Hekimian and Dr. Richard Deckelbaum from Columbia University, who are here taking part in an international symposium at the American University of Armenia. Stay with CivilNet.